Hi everybody, and welcome back to today's video. We're going to be talking about knee issues and injuries and giving bodywork techniques that will support recovery and overall circulation for this area of the body. So I just want to disclose beforehand that if there is any laxity or looseness in the knee joint from meniscus tears or ACL, LCL, PCL, MCL tears, anything that if there's the knee is hyperextending or funky to move or hurting, please be mindful and always check in with your person while you are doing these maneuvers and move slowly. That's key here, moving slowly with the knee. So I just want to say that before we get started. And the knee can be a really complex area as it tends to be kind of the middleman energetically. It's usually a secondary symptom of projects up or down the chain, like in the hip and the ankle. So we will keep it mostly simple for today, approachable techniques for everyone here. And then I also want to invite you to start to think deeper into the body, psyche, energetics as we go into more videos with all this stuff, okay? So I'm going to give a small introduction to this here today. I feel the calling that it's time to discuss, but we can keep doing body work, over and over again. You can do these techniques for chronic symptoms and they can feel really good and they can temporarily relieve a lot of pain, which is awesome, right? And so if that's where you are and that's where you want to stay, great. But I also want to invite some of you who want to get kind of a bigger picture and understanding of the body, the mind, the psyche, and your biology, and how that works with you and how that manifests in your life. So, especially with these chronic things going on, it can be frustrating to keep asking the questions of why is this happening, why won't this go away, and things of that nature when you have symptoms that just keep coming back over and over again. Okay, so we're going to get into the energetics of the knees, which, like I said, they are the middleman of the leg. They mobilize us, they move us forward, they help us perform in life physically, and they help us in stepping forward and moving in the direction that we want to go in life. So when we have chronic knee symptoms, what do you think about, like, in your life where you feel like you've had or you may be currently having a conflict of feeling like you are not performing the way you want, or if you're not stepping forward the way you want to live in your life, moving in the way you want, or if you're unsure of how you want to move forward, and maybe just the way that you're living your life now doesn't honor you and your true desires, the knee is going to reflect that. It's a self-devaluation of a performance conflict in the brain where there's a physical performance, either activities or sports, or it can show up in your job, your life, your profession, or your family, or just maybe even your overall connection socially with others and with yourself. It's how you interact and walk and move. Okay, the knee is just like fundamentally right there in the center. And then from another perspective, TCM, traditional Chinese medicine, because that's how I'm trained, the knees belong to the kidneys, and along with blood and qi stagnation in the meridians that travel through the knees, which obviously contribute to injury and pain. We also want to think about nourishing the kidneys and the emotions that go with that, which is fear and depletion of the kidneys that happens when we get older, of course. But I want to talk about the fear aspect here, and that ties right back into fear of moving forward and the fear of performing in life. So it all kind of comes into one big theme when you look at it from all these different angles. And a good exercise that you can do is just simply walking backwards, like on a treadmill, or find a field or a sidewalk and do 30-second interval sets of walking backward slowly and mindfully. And energetically, this is a great way to like retrace your steps if you're unsure in life. When you're not aligned with how you're moving forward in life, you can retrace by walking backwards, doing these steps to kind of recalibrate and balance. And when you're ready, you can move forward from there. From a physical standpoint, walking backwards is just a fantastic exercise to strengthen your hamstrings, your glutes, and all those supportive muscles around the posterior chain in the knee, which tend to be weak and tight a lot of times. And so when those are weak and tight, we get pain back there. So we want to strengthen that as well. and that fascial chain, the whole posterior fascial chain up to the hip, down to the calf and the foot. When that's functioning better, when that's stronger, you're going to move differently. You're going to move more freely, abundantly, and with grace. So that is physically a great thing to be doing. And then just the mindset of like being present in your body and getting curious with when you work this out, when you talk with each other as you're working it out on the table here, what comes to surface beyond the physical, right? There's so much more to physical and body work. So talk with your person as you're working, as you're receiving work. Get curious with yourselves. Like when you're doing a technique, what comes up for you in your mind and your heart and in your emotions? Like this stuff is all important and it all means something. And so that is going to help bring resolution long term to these things that you're experiencing as physicalities. So I just want to leave that there as a tidbit to have, to ponder, food for thought. And if you have questions about this kind of like psyche, brain, body connection, what that looks like for you in specific cases, feel free to send us inquiries. We can explore that together one-on-one. But I just want to start adding little tidbits into these videos on the themes that we're working with physically, what they can mean more biologically and energetically. So think about self-evaluation with knee stuff, performance conflicts, moving the way you want to, or maybe not moving the way you want to in your life, and what that looks like and how you can kind of restore that psychologically as well. Okay, and the aspect of fear. If fear is showing up in your life more often than not, what can you do with that? How to get curious with that? When can you become aware of fear dominating your decisions and your movements? And there's a lot that can resolve just from becoming aware of these things. So, all right, happy explorations and have fun with these techniques today. Okay, so we're going to start with our first technique today, which is going to be simply scrubbing the knee to start out. So this is going to be very light and superficial, almost like you're scrubbing a dish. You don't need any oil or lubrication. But the idea for this is to warm up the surrounding fascia, connective tissue into the knee, around the ligaments area, outside, inside, above, below, and kind of get the warmth, the circulation coming into this area, as well as just kind of opening up those really superficial layers of tissue as we go a little bit deeper. So it's a great warm up. So this can look pretty simple. Be mindful of any pain that your person might be having. So you can keep your palms kind of straight, working your way up the thigh, around the knee, and down, below the knee, inside, outside, above, below, above, below. Let's do that for about 30 seconds to a minute. It should feel already, when you stop, a little bit looser, warmer, more fluid in around the area. So the next technique is going to be a pretty simple, straightforward one. This is a more energetic, broad maneuver rather than just focusing in on the physical knee. What we're going to be doing is working with the yin meridians of the leg and the yang meridians. So the yin meridians go from the inside of the leg and foot all the way up the inner thigh into the hip and beyond. Okay, we're just working with the leg though. So yin and the energetics of yin channels here go upward, and then the yang channels on the opposite are on the outside and the back of the leg, and they come all the way down the outside of the leg to the outside of the foot. So clearing blockages in the energy meridians, which definitely will be contributing to stasis in and around the knee when you have knee pain. This is working with that. So what this is going to look like is a gliding motion. You can have oil or you don't need oil. It's all about the intention of energetics here. So we're going to be gliding up the inside of the leg. Once you come to the hip, we're going to switch outward and we're going to drag down the outside of the leg like so. We're going in, inside of the knee, up the inner thigh, keeping palm contact, and then brushing, sweeping down the outside of the leg. And I want you to even think about as you go that we're brushing and pushing, encouraging the inflow, chi and blood upward. And then on this outside where we get a lot of stasis in the yang channels, I want you to drag and sweep and then sweep it away with your hands. Actually flick your fingers as you come off that foot. Okay, so a couple more times for demonstration. In and up, yang and down, flick, release the energy. In and up, yang and down, flick, release the energy. From a different angle, you can do both legs at once, which I highly encourage, even if you're having one-sided knee pain. So we're gonna go brushing up inside of the legs to the hip crease, coming down the outside of the legs, sweep, brush away. Inside, pulling down outside. And this one can feel really good to use oil on, so definitely if that is available to you, or lotion, try that out. And you can do that 3 to 5 times to clear the energetic pathways before moving on. For this next technique, we're going to be doing a palm slide and smush, I'm going to call it, okay? So essentially we're going to be doing what's going to be drawing the quadriceps and their attachments at the top of the knee down toward the knee. And then the tendon of the quadriceps, which is right below the kneecap, we're going to be smushing that up and in towards it. So a lot of times with knee pain and knee injuries, we'll get really tight and taut quadriceps. And as they get extremely restricted and they're holding on to tension, their attachments, their tendons at the knee tend to pull the kneecap up because there's so much tension up higher. And so you'll get a lot of extra knee pain, residual knee pain, just from the muscle tension essentially moving the kneecap in an unwanted and yucky way upward. So what we're doing here is we're smushing the quadricep tendons down back into the knee, and we're kind of smushing that kneecap down more towards the shin as well. So top hand, you're going to be using kind of the outside pinky edge of your palm and the meaty part of your palm to apply downward pressure, and then smushing down. And then your bottom hand is going to be more of a base support system, holding the bottom of the kneecap in between your thumb and your index finger as you slightly smush up, but more just holding that pressure. This top hand is going to be doing most of the work. So we're going to support at the base, and we're going to smush downward. And as you come downward around the knee, see if you can kind of hug and caress the kneecap at the top so that you're giving a nice firm pressure around the entire perimeter rather than just on one edge or one area of the knee. So check in with your person as you go. You can do this about 10 times. It should feel really good. If it's feeling like it's causing more pain anywhere, lighten up or don't do this one, skip this one. And another key point to have here too is no oil. That way you can glide much slower and apply broader and firmer pressure that feels more therapeutic. And also make sure that you have some padding underneath your person's knee, a pillow, a bolster, anything like that. That way you're not getting hyperextension in the knee joint as you perform this motion. And there you go. And for our next technique, we're going to be doing a quad release for the rectus femoris muscle. So we worked on the quads and their attachments down here at the knee, but one of the quadriceps, the rectus femoris, actually comes up and attaches through the hip as well. So it has two attachments. It moves two joints. It moves the knee joint and it also moves the hip joint. It's a prime mover up here in the hip. So it's really important to work on both ends of this tendinous attachment to encourage both ends essentially. So this will make a big change in knee pain as well. So how we find this is you're going to come up to the hip and you're going to cup the hip bone. So the bony part of the hip, the ASIS, is going to stick out if you cup the hip. So you can find the prominence there. Okay, so once you find the prominence of the hip bone, you're going to just come directly down. So I'm not near the groin, I'm not near the private areas. You find hip bone, cup it, find the bony prominence, and come straight down. And now we're already working into the tendon and the getting into the muscle meat of the rectus femoris. So is this tender on you? It might be for some people, so you can kind of feel around a little bit. It might feel good to just do some palm pressure at first and kind of work your way down. If it is really tender and they're kind of jumping, this will desensitize the tissue in that area. So then when you're ready, you're going to come down. And for this one, we want to have the knee bent. So we have a bolster currently under her knees. I would encourage even more so if you can get a bigger pillow, or even if you can get your leg up under their leg. That's a little bit more complicated. So just have a plethora of pillows if you can under their knee. The higher their knee is up, the more that they will be in hip flexion, and the easier this will be to get into because the muscle will be shortened a little bit. So when muscles are shortened, they are a lot more accessible to get into and to release. So we have our knee bent. Let's even have you come up a bit more, actually. I'm going to bring this bolster out. So we actually have her knee bent, foot on the table here. If you want, you can bring leg up to kind of stabilize the foot, or you can even have your person let their knee fall outward and support it with your body. So she has her knee into my rib cage right now. So we can work with this a lot easier now that the hip is fully flexed in a good position. And so I'm going to slide down same way, finding that point ASIS, coming down. And then with two hands here, I'm doing one for demonstration purposes, but with two hands, find the most taut, hard area. Check in with your person. Is this tender? You move down a little bit. Is that tender in there? Yeah. Okay, so we're going to stay here. You're going to do finger pressure. This is why I say to have two hands, because you can stack your fingers on top of one another. And it can be a lot better of a force downward and inward, but we're going to just apply steady pressure, not to the point that they're screaming or in pain, but just to a point that feels intense, but they can breathe through it and hold. You're going to hold and stay here until you feel something soften. This might be a minute, this might be a few minutes. If you're not ever feeling anything soften, check in with your person. They might be holding their leg and not being relaxed. If that's the case, try a different position. If they're unable to fully relax with their leg up like this, you can come back down with just having them relax with the knee on top of a bolster. And you'll go back in and holding until you feel something soften. And then when you do, go down a little bit more and just explore this whole tissue area. And let yourself sink in. While you're here, relax your body as well. Lean against their knee, let their knee lean against you, and breathe together. If your shoulders are up by your ears, let them drop down. Use your body weight to really sink in as you support and facilitate change for their body. Okay, so play around with this one. This one's a really important one. I highly recommend doing no matter if you do the other techniques. So after you have done these techniques, we're also going to do a little bit of an adductor stretch, inner thighs. So you can think of this as also opening the yin channels of the inner leg, which will also be playing a huge part in any knee condition and imbalance. So we're going to do a straight leg adductor stretch to begin with. So if your person's on a table, have them move to the edge a little bit. And you're going to take the leg, make sure you're supporting underneath the knee with one hand. Other hand is at their ankle. And you're going to just draw them off the table and switch sides. So you're going to come to the inside of their leg and support under their knee. So this is her left knee and my left hand is underneath the outside of her knee and kind of holding it up so it doesn't hyperextend down. We want a little bend always, okay? And we don't want their leg up high. We want it just at hip level. And the front of my body and pelvis is pushing into her shin or her inner calf as we come outward. So almost straight leg, and you're just going to slowly inch outward until your person feels a stretch or until you feel an end range and it stops. And then when you do, you're going to have your person gently press their inner leg against you. So go ahead with very light pressure for a few seconds. Press and relax. And once they fully relax, you feel their leg drop again, you're going to take another step or an inch out. Have them press again, in, hold, relax. Once the leg drops, you go another inch or two until you feel that end range. Okay, and you do that 3 times. So one more time, press in against me, hold, relax, and you come out a little bit further. And then we come back in, back on the table, roll the leg a little bit, back and forth. And for this next one, we're going to do another adductor stretch with a bent knee this time. So I'm going to have you guide your person's knee up. If it feels okay, plant their foot down, and then you're going to slowly guide their knee outward. Keep one hand on the outside of their knee, and the other hand is going to come up to that same hip bone area. You're going to press downward to support their hips and keep their hips pinned on the table. So keep dropping your knee out all the way until it feels comfortable to stop. And obviously she is quite flexible. Most people aren't going to get this far. They might be halfway down. But wherever they come, you're going to keep firm pressure downward on their hip, and you're just going to bring one hand on top of the inner thigh and very gently, broadly and firmly press down. And you're going to go back and forth on the inner thigh and on the hip. You're kind of walking your hands back and forth, left and right, hip to thigh, hip to thigh. And then you can come out to the knee if it feels okay. Pressing down one more time, deep breath. And then you're going to come underneath the knee again, bring them back up and reset. Okay, so we have our person flipped over. This time if they're on their belly, give them some padding, pillow, bolster under their ankles so that their knees are slightly bent. And we're going to be doing the same scrubbing to warm up the area, this time on the back of the knee. So you're coming below the knee, above the knee, and you're just scrubbing with straight fingers and palms superficially, not too much pressure. The idea is to create some friction, warmth, heat, circulation. Above the knee, get on the inside of the thigh and outside of the thigh, below the knee, inside, outside, back of the knee, and above. Okay, so 30 seconds to a minute of that, and then feel the difference of how the tissue is softened up. Keynote here, if you are working on the back of the knee, ensure that the crease, the popliteal crease, that we're not applying firm pressure down into that crease area. There's a lot of vascular structures going through here as well as nerves, and it can feel really yucky to put a lot of pressure right into the back of the knee. That being said, we are going to be doing a little work of direct pressure below the knee crease and above it. So just for better show and demonstration, this is the knee crease, and that's what I mean of avoiding applying direct pressure into that area, okay? But we are going to be doing a little bit, an inch or so below and an inch or so above. So for this next part, I want you to feel the back of the knee. If it feels puffy, if it feels like there is fluid in and around this area, we're going to start with a little bit of some lymphatic drainage. And what that will look like is pretty simple, but we do have lymph nodes in the back of the knee. This is where the lower leg will drain into as it collects before moving up into hip and abdomen. So if there is fluid accumulation, then this can also be a great way to relieve some pressure and pain, but also a really important way to start knee work on the backside before going deeper into the muscular structures around it. So with this, you're going to be doing very light strokes. You can have both hands. And we're going to be just doing very light circular strokes around the knee crease. And we can work on the knee crease here directly because we're not doing deep pressure. We're doing very light circular motions. I'm going to use both hands here. I'm just using one for demonstration purposes. But the idea here is to make contact with the skin for lymph work and then kind of drag it, drag it, drag it. Okay, so spend a few moments just doing that to kind of clear, open up this pocket, and we'll move on. So this next part is going to be almost another way to facilitate lymphatic drainage, but it is technically a myofascial hold. And what we're going to be doing is applying one hand above the knee and one hand below the knee in a crisscross direction. So one hand is putting pressure upward and then one is putting pressure slightly downward. This can feel really powerful for any kind of meniscus tear or posterior like PCL tears, and tension in the hamstrings and calf muscles. So this one might be a go-to just in and of itself, regardless of any of the other techniques. So I highly recommend doing this one as your kind of bread and butter. So we're going to come one hand above, and this is a myofascial hold. So the pressure is going to be very, very minute, almost just bringing hands to contact. And then it's as if we're just sinking into soft clay, as they say. It's almost an energetic hold. We're not pressing in, we're just making contact and kind of sinking in. And then from there, very gently, my bottom hand here is going to intend the energy downward towards the foot. My top hand here is going to intend the energy upward toward the hip. And as I do this, there's a gentle opening and a gentle stretch in the fascia. But again, I'm not pressing deep downward or inward or upward or downward. Just holding and intending to open that space around the knee, back of the knee, the inside of the knee. You're going to stay here and breathe. Breathe with your person. And with any myofascial hold, it's going to be about 3 to 5 minutes if you can have that. So be in a really comfortable position for yourself. No oil. We want to stay in contact right with where we are on the skin. And as you sit and hold, this is where it gets fun. You might start to pick up on pulsations, the arrival of chi. You might get tingling, heat, pumping, and your person on the table might notice things as well. But then we might start to notice the real effect also. What we want to feel for is that opening. So where we are now, her tissues just opened a little bit and my hands just kind of dropped down further. They spread apart without me even trying. And we want that. That's the stretch becoming a release. When you're ready, you come out by bringing hands back toward each other and slowly lifting off. So 3 to 5 minutes for that technique. If longer, that might be sufficient or needed as well. All right, so our next technique here is a hamstring press. Ideally, you'll be on the same side of the leg that you're working on. For demonstration purposes, I'm on the opposite side. So for this, what we're going to be doing is applying our palm down onto the hamstrings, which are the muscles that go along the back side of the thigh from knee to hip. And we're going to be using our other hand to move the leg. So this feels really good. Knee pain or no knee pain. We're going to be bending the knee into planes that are acceptable to your person, okay? So we'll be cranking it around just back and forth in a nice 45 degrees or so. And you're going to apply pressure on different parts of the hamstring as you go. So I'm going to press downward with my palm. I'm going to come up and come down. So as we press in and up, it feels like a compression massage. And then as we keep that pressure and straighten, it's almost a stretch for the hamstring as well. So you're getting kind of a double effect here. Okay? You can kind of go back and forth, side to side with the leg as well, because the hamstrings also do a little bit of that internal and external rotation into the knee here. So that also feels a little bit more subtle in the nuance of the effects here. So bending up about 90 degrees, waving side to side, left and right, supporting the ankle here as you go, and coming back down. Okay? And then from there, we're going to come down to the knee and placing, not at the knee crease, but just right above, a soft fist. So we're going to make a soft fist and let your hand sink in and coming up again. From here, we're going to be applying pressure downward. This is getting into more of the tendons. And we're going to go back and forth. So we're getting into muscle bellies and then into tendinous attachments. Both are very influential. Tendinous attachments are vitally important to work on when there are chronic issues and old injuries. Okay, so you can come down, reset the hand. I'm kind of getting my knuckles into the tendons right above the knee. I'm not in the knee crease. And check in with your person as you go. Make sure there's no pain. And then come back down. Give it some love, massage it out to the calf, to the leg. And with this final technique, we're going to be getting into a muscle called the popliteus, which is phrased the key to the knee. And it is a very small but powerful muscle that starts at the femur, so the thigh bone, and crosses the knee joint on the back side and kind of comes down into the top of the calf. So I'll do a close-up here in a minute of what area we're going to be sinking into. But this one is a very, again, nuanced muscle that helps stabilize the knee when we're standing, when we're moving. And if it gets angry, if it gets tight, it kind of makes the whole knee go haywire. So really important one to be doing no matter knee condition. Always check for the popliteus. So with this, we're going to be bending the knee up, and we're going to be supporting it first when we find the popliteus. I'll do, again, another close-up in a second. And when we find it, we're going to be applying pressure. And there's a key here. So top hand is going to support the foot by pressing downward. So my hand is actually applying pressure on her heel downward slightly toward the table. So it's compressing the knee joint this way. And then we're going to be kind of turning the heel outward, toes inward. So if you think pointing your toes slightly towards the other leg. So down, and then turning toes inward towards the other leg as we get into the popliteus here. And then the whole leg is going to come just gently outward. I don't want you to get caught up on those three things: down, toes in, leg out. Make sure mostly that you're just having the knee bent at 90 degrees with the pressure downward. That will be more important than anything else. And when you find the popliteus, we're going to be putting in finger pressure this way toward the muscle, getting into the muscle belly, and then we're going to be holding. Just like a myofascial release, we're going to sit here, we're going to sink in, we're going to wait. You're going to breathe with your person until you feel something soften. And when you do, that will be the release of the muscle. You might have to reorient your fingers a little bit to a different place. That feels like you'll feel this muscle popping back out at you. So that's really a nice hint that you're on the right spot. It might take a couple minutes here. When it finally does release, you're going to come out with this hand. This top hand is going to shake the heel back and forth. You can see the calf muscle jiggling. That's what we want to kind of reset. And we'll come back down, scrub it out. So from a close-up viewpoint here, this is left leg. We're at the back of the left leg. Popliteus muscle is going to be coming across the knee joint here, okay? So we find the knee crease, and we're going to come slightly down, and we're going to feel around where the muscle pokes out at you. It's going to be slightly inward where you're going to feel it, okay? So here's the middle of the thigh. We're coming right down below the knee crease, and slightly medial or inward is where we're going to feel it. I already feel it even though her knee isn't bent, but then we're going to bring the knee up, bend it first, keep it supported, and then you're going to bring your bottom hand in with two fingers, find slightly inward where the muscle is poking out at you, and then you're going to hold sustained pressure, bring the knee up to 90 degrees, apply your pressure downward, toes inward, leg slightly outward, and hold, and breathe. And there you go.